Good afternoon, everybody. I'm Donald Clark. It's good to be back. We're a tad bit early today, but we're trying to thread the needle with what we do here and what we do with you guys. So, just like I promised, we have Jennifer here today, and she is going to talk about intralipids, everything intralipids. So, if you have any questions, feel free to ask your questions. And if you don't have any questions, great. I'm pretty sure, she's the lipids queen around here. So, if she for some reason doesn't answer it, you can text me or ask me, and I can ask her. Or by all means, I'm available on Wednesdays for consultation. So get set up for a consultation with me on Wednesdays. So here we go, Jennifer.
Thank you, Donald. Hi, guys. My name's Jen. I am the lipid nurse at CNY in Syracuse. Some of you may know me and may have seen me. Some of you may just be meeting me, but I am who will be infusing you if you do lipids at CNY in Syracuse. We tend to do these a couple days prior, or maybe sometimes one day or the same day as transfers, IUIs, anything like that. What it mainly does is this is composed of fats, good fats, avocado fats, egg yolks, soybean oil, glycerin, and pH to balance it out so it does not burn going in. It does several things, but the most important, we have you do it pre and during, or before the transfer, is because it helps suppress your natural attacker cells so they don't attack the embryo and the sperm that we're trying to place. It does have other benefits as far as helps with inflammation within the body that you get during this cycles. It also helps with any any residual bleeding that you may have from procedures that we are doing to you constantly, as you know. It's also good for the development of the embryo. I have a lot of women that come into us weekly till 10 to 12 weeks of pregnancy. I'm a firm believer that this literally helps with the development of all the essential functions of the embryo to the baby. This only takes about 10, 15, 20 minutes. Depending on how you tolerate it. The first treatment, I usually tend to go slower, usually about 30 minutes. Just to see how you tolerate it. Sometimes it can make your arm a little heavy. It can happen during the infusion as well, as far as feeling like you worked out or got a shot in the arm. That sometimes is a normal side effect, and it lasts usually. Some people say it stops after the infusion. As soon as I stop the infusion, they say their arm feels a little bit better. Some people, they say it lasts into the night. I do tell them just to kind of heat pack it, warm compress as needed, but it should be fine within the morning. You also want to make sure you drink plenty of fluids with this. It gets filtered through the liver. So we want you to drink at least 5 bottled waters after the infusion to kind of help it flush through your system and circulate and get where it needs to be to help protect the baby. What else can I tell you about this? After the infusion, because it does go through your liver, we want you to avoid Tylenol and alcohol for 3 days after this. If you do run into something that you need, to take Tylenol for, just give us a call and we can advise you if we feel like it'll be all right or, we should avoid it for now. It's kind of on a personal base-to-base level. Let me see what else is there about it. Drink plenty of fluids. There's not really much about it other than the benefits. Side effects wise, it's unless you have issues with your liver to begin with, as far as toxicity or metabolizing things, you shouldn't have any issue other than the normal arm ache. But do keep in mind, if you have any difficulties with anything, I say urinating, any yellowing of the skin or eyes, which is very extreme, but because it does deal with the liver, it could be jaundice. Any fever, chills, aches, pains, anything that you feel uneasy about, just give us a call. We're always around, so better be safe than sorry, especially when we're dealing with these little babies. And like I said, I do these into 10 to 12 weeks of pregnancy whenever we usually discharge you. But there are certain circumstances where I infuse women further than that, given if they have some type of blood disorder, disease, or anything like that. That's on a base-to-base personal level. And the doctor can help you with that, or whoever your scanner is can help you with that. Oh, the lipids. I'll show you what it looks like because it's kind of disturbing. It's kind of just milk looking, but there is no milk in it. And you do get a sense when you start to infuse it sometimes of a smell or a taste of chalk paint or whiteout. Only lasts for a couple seconds, but I do like to tell my patients about it because it's a little disturbing if you don't know that it's coming. I think honestly, that's about all I can tell you about the lipids. The main thing that we love doing it for is suppressing the natural attacker cells so they don't attack the embryo. It kind of calms down the immunity. So they're not attacking essentially something that your body thinks it's trying to harm you. We can do these 3 days prior to your IUI or transfer. We can do them the day of, or we can do them the day before. All of them have the same benefits. All right. So I think that's about all I can talk about for lipids today. And if you guys have any questions, you can always call me too. I'm at the Syracuse office, and my name's Jennifer, and I hope to see you guys soon. Bye. Good luck.
Thank you.
You're very welcome. Thank you.
Sure. All right. So that's Intralipids, and I hope that helps out. I certainly learned something. So it's been a good week here. We've been super busy and lots of new faces, and it's been really warm and dry. We those torrential rains haven't started, and we're kind of waiting on that. But flower gardens are looking great, and I'm pretty happy. So what we've talked about in the past is making sure that we don't get overheated. When you're stimming, it's you're going from 0 to 60 in 2.2 seconds. So there's a lot of heat inside the body. So, and plus this time of year with a lot of heat outside, a lot of heat inside, it can accumulate inside the body. And so we want to make sure that we're constantly moving heat out of the body. And some of the best ways to do that is through urination and bowel movements. So, continue to drink lots of water, try to avoid sugars, try to avoid those empty calories and carbs. Just continue to focus on high fat foods and carno and all of that. And it does make a difference. And so, we talked about if you go into the next season, and believe it or not, I hate to say it, but we're rolling up on the next season. So late summer season is kind of another season to prepare for. And if you roll into the next season with heat accumulation, it can be bad for you. You can end up having constipation, a lot of ringing in the ears, bloodshot eyes, and difficult seeing at night because you have a lot of heat. And so we want to make sure that that we eliminate the heat during these hot months. Let's see. I'll be back next week, and we're gonna, it's always nice to have special guests because they help us understand what we do most of the time, and it also gives us kind of a heads up on what to expect. And my goal yet is still to get somebody from the front desk to kind of give you guys an idea of what to expect when you get here, as soon as you walk in the door, what to expect, bladders, consent forms, where to go, all of that. And that's on the day of your transfer as amongst just normal days of cycling. And so continue to slow down, continue to enjoy the small things in life. Don't work overtime. Just, try to give yourself some downtime, especially when it starts to get really warm, and flush that heat out of your body. Stay away from the sugars. And Jen, what's your email? Do you have an email here?
Oh, at jlopez@cny.
jlopez@cnyfertility.com. Okay, you guys, thank you. I hope this was informative. It was for me. And we'll see you guys soon. Thank you.